Hello, this is Dr. DeWeese with the Orthopaedic Institute of Western Kentucky. I'm going to talk to you a little bit about shoulder arthritis. Patients come to see me all the time for shoulder pain and stiffness. Just like in the hip and knee, the shoulder joint can wear out. The joint can be treated with anti-inflammatories, injections, physical therapy. Those can sometimes help and put off the need for shoulder replacement surgery. But in a lot of cases, the shoulder continues to wear, hurt, and patients need shoulder replacement surgery. Historically, when we first started doing shoulder replacements 50, 60 years ago, I'll just show it here on a diagram. This is your collarbone. This is the shoulder blade. This is the socket, and then this is the ball of the arm bone that goes down with the shaft of the arm bone to the elbow. And this is the joint that wears out. So the first shoulder replacements were done by removing this ball and replacing it with a polished metal ball that's attached to a stem made of metal that goes down the hollow arm bone. And then that bone grows into that stem and becomes part of you. Then on the socket, we would remove just a little bit of the arthritic bone and cartilage and replace it with a plastic socket that was typically cemented in place to the bone. And those procedures do pretty well. There's certain types of shoulders those are best used for. Those are patients who have a nice normal rotator cuff tendon on top of their shoulder. These shoulder replacements perform pretty well. The recovery is 4 to 6 weeks typically. There's therapy involved. Pain relief is pretty reliable. Durability is a little bit of an issue. This socket piece, if you look at the national data over many years, about 1 in 10 of these becomes loose at 10 years. And that requires us to go back and convert this shoulder to a new shoulder replacement. Over the last 10 or 15 years, it's become more popular to do what's called a reverse shoulder replacement. So I draw the same thing again: collarbone, shoulder blade, the socket, and then the ball. And again, we're dealing with the arthritis of this joint where all the cartilage is wearing off and bone is rubbing against bone there. Instead of doing a regular shoulder replacement, more and more what we're doing is going in and putting the reverse of what God does. We put in a plastic socket here, or cup, that's attached to a stem that goes down the bone like before. And then on the socket, we're putting a ball that's anchored to the socket with some screws. And that cup then articulates with that ball. And that's the reverse shoulder replacement. It's a more forgiving type of shoulder replacement. It does not require a normal rotator cuff tendon. And in fact, these were developed to account for those patients who don't have good rotator cuff tendon. This reverse shoulder does very well. They're very durable. You don't have to worry about things getting loose like you do with the more historical primary shoulder replacement. This procedure takes about the same amount of time, an hour in the operating room. We usually we usually inject the shoulder ahead of the procedure. You're sedated for that, so your arm is nice and comfortable for the first day at home. Usually go home the same day. The reverse shoulder, you can start kind of using it right away. I have some patients at 2 weeks when I see patients back who are already moving the shoulder very well. I would say at least half the patients go to therapy to get the shoulder moving. The regular shoulder replacement, it requires a little more care. You have to protect it a little bit more early on. The recovery is probably 2 to 3 months, whereas the reverse is 1 to 2 months. So very effective treatment for arthritis of the shoulder. Thanks for listening.